Hello friends, so today we will learn about a few bacterial diseases. So let us learn. First is typhoid. So typhoid disease is caused by a bacteria called Salmonella typhi. Its incubation is 6 to 30 days and the part or body parts which are affected are intestine, liver and spleen. Transmission, so it is transmitted by contaminated food and water or close contact with an infected person. Next is symptoms. So the disease involve a few common symptoms like high fever, weakness and fatigue, abdominal pain, headache, loss of appetite. So these are very common symptoms of typhoid. Next is diagnosis. So blood, stool or urine cultures are used for the diagnosis. One more important question from here is which test is used to diagnose or for the diagnosis of typhoid? So it is Vidal test. Next treatment, so a few antibiotics like ciprofloxacin, azithromycin, these are used to treat the typhoid. Next is pneumonia. Pneumonia is caused by Streptococcus pneumoniae or it may be caused by Haemophilus influenza. So it can be bacterial and maybe viral or fungal. Incubation period is 1 to 3 days in case of virus and 1 to 10 days in case of bacterial infection. Organ or part of the body which is affected is mainly lungs, air sacs or alveoli. Transmission, so it is transmitted by respiratory droplets from the cough or sneezes of the patient. Symptoms include chest pain during breathing or coughing, fever and chills, cough with phlegm. Diagnosis is done with chest x-ray, sputum test, and for treatment some antibiotics can be given and it also needs some supportive care with fluids and rest. Next one is dysentery, bacillary dysentery. So its causal organism is Shigella species. It is again a bacterial disease. Incubation period is 1 to 7 days. Or the part of body affected is intestine. Transmission is through the contaminated food and water or direct contact with infected person. Symptoms include bloody or mucus filled diarrhea, abdominal pain and cramps, fever. Diagnosis can be done with the stool culture for Shigella, blood test in severe cases. Treatment involve treatment of doses of antibiotics like ciprofloxacin and ORS oral rehydration therapy is also needed. Next is leprosy, which is also known as Hansen's disease. It is caused by a bacteria called Mycobacterium leprae, and the incubation period is 2 to 5 years typically. The organ or part of body affected is skin, peripheral, nerves, mucous membrane, or of nasal cavity. Then transmission, so prolonged close contact with an infected person can transmit the disease or it may be sometime due to respiratory droplets. Then symptoms, skin lesion and lumps. This is the main symptom of the disease. Nerve damage leading to loss of sensation, muscle weakness. These are all symptoms of leprosy or Hansen's disease. Diagnosis can be done with skin biopsy or slit skin smear. Then PCR test can be used. What is PCR? It is a polymerase chain reaction. So it is used for diagnosis of different types of diseases. Next is treatment. So multi-drug therapy is required in case of this. Next one is diphtheria. So diphtheria is caused by Corynebacterium diphtheriae. Incubation period is 2 to 5 days. Organ affected is throat and tonsil, respiratory tract, or in some cases skin also get in. Next is its transmission. So respiratory droplet from cough or sneezes or contact with contaminated objects. Symptoms include sore throat with thick gray membrane, which later on may cause difficulty in breathing and swallowing. Swollen lymph nodes in the neck, fever and chills. These are all symptoms of the disease. Next is diagnosis. So throat culture can be used to diagnose detection of the diphtheria toxin. Treatment: diphtheria antitoxin to neutralize the toxin, and antibiotics like penicillin or erythromycin are also given. Next is cholera. So it is caused by Vibrio cholerae. Next is its incubation period is 2 hours to 5 days. Intestine is the body part which is affected. Transmission is through the contaminated food and water, and the symptoms involve profuse watery diarrhea, which is also called rice water stools, vomiting, severe dehydration, and electrolyte imbalance. So these are the chief symptoms of cholera. Then diagnosis: so stool culture and rapid dipstick test on in outbreak settings. Next, treatment: so ORS, oral rehydration solution. It is used to balance the electrolyte in the body and to again hydrate the body. Next, intravenous fluid can be given in severe cases. Antibiotics again to reduce the duration of the effect. Next one is tetanus. So tetanus is caused by Clostridium tetani. 3 to 21 days is the incubation period. Nervous system is the main part of the body which is affected. Transmission occurs through open wounds which are exposed to contaminated soil or objects. Next is symptoms. So muscle stiffness, spasm, especially in jaw. So it is also called lockjaw. Difficulty in swallowing, painful muscle contraction. These are all symptoms of tetanus. Diagnosis: so clinical symptoms are used to diagnose the disease, and no specific lab test is used. Treatment: tetanus antitoxin or immunoglobulin can be given. Muscle relaxants they are used, and antibiotics like metronidazole or penicillin they can be given, and it also need a lot of sport and care. Next is plague. Plague is caused by Yersinia pestis, and its incubation period is 2 to 6 days. Lymph nodes, lungs, and bloodstream they can be affected, and on the basis of there are types of plague like bubonic plague, pneumonic plague, and septicemic plague. Transmission occurs through the flea bites from infected rodents or direct contact with infected animal tissue. The symptoms include sudden high fever and chills, painful swollen lymph nodes, cough with bloody sputum, and diagnosis: so blood, sputum, or lymph node culture they are used for diagnosis. RDT, that is rapid diagnostic test, can be done. Treatment: antibiotics like streptomycin, doxycycline, or ciprofloxacin are given, and it is important that early treatment is given as quick as possible. Next is whooping cough or pertussis. So Bordetella pertussis, it is the causal organism. 7 to 10 days is the incubation period. Respiratory tract, trachea or bronchi, they are the affected organ. Respiratory droplet from coughing or sneezing, they act as the transmittory objects or substance. Symptoms involve severe coughing, which is followed by a sound called whooping sound. Runny nose, nasal congestion, mild fever, they are all the supportive symptoms. Next, diagnosis: so nasopharyngeal swab culture is used to diagnose. PCR testing can also be done. Treatment involve the use of antibiotics such as azithromycin or erythromycin, and it also need supportive care for cough relief and hydration. Next one is syphilis. So syphilis is caused by Treponema pallidum. 10 to 90 days is the incubation period. Skin, genital parts, mucous membrane, heart, brain, and nervous system, they are affected later stages. Next, transmission. So it is a sexually transmitted disease, so it is spread by sexual contact with the infected person. Symptoms involve painful sores and skin rashes, fever, swollen in lymph nodes. Tertiary symptom may include damage to organs like heart, brain, and nerves. Diagnosis. So blood test for antibodies is done. Treatment. So antibiotics, usually penicillin injection, are given, and it need a close monitoring and follow-up blood tests. Next is anthrax. So it is caused by Bacillus anthracis. Its incubation period is 1 to 7 days, or rarely 60 days. Organ or part of the body affected are skin, lungs, intestine. They can be affected. Transmission occurs through the contact with the infected animal or animal products or inhalation of the spores. Symptoms include cutaneous symptoms involve black sores and swellings. Inhalation symptoms include severe respiratory distresses, fever. Gastrointestinal include nausea, vomiting, bloody diarrhea. Next is diagnosis. So blood culture can be used for diagnosis, PCR testing, and chest X-ray in case of inhalation anthrax. Treatment involve antibiotics like ciprofloxacin, doxycycline, antitoxin for severe cases. Next one is botulism. So it is caused by Clostridium botulinum. The incubation period is 12 to 36 hours. The body parts affected are nervous system, which mainly include muscles and nerves. Transmission occurs by the ingestion of botulinum toxin through improperly preserved food, wound infection, or exposure to the spores. Symptoms, they include muscle weakness and paralysis, difficulty in swallowing or speaking, blurred vision, drooping eyelids, respiratory muscle paralysis in severe cases. Diagnosis. So clinical diagnosis based on the symptoms mainly and exposure history. So toxin detection in the blood or food sample can also be checked. Treatment involve botulism, antitoxin. Sportive care include respiratory support if needed. These were some bacterial diseases, their causative agents, and a few symptoms and treatments. Next video we will learn about some viral diseases. Thank you.